Hello out there in television land, and welcome to yet another edition of It's Your Health. Well, I'm getting mauled here.
It's August.
It is August. You know, I can't believe the summer went so quickly. I think we need to replay it. What do they call that? TiVoing? But getting back to basics, I'm here with my bride, Kathleen, as you can tell. And we're bringing you the latest and greatest in healthcare information. Yep. We'll be right back after this brief commercial message. Make sure you check with your healthcare provider before doing any of the things that we do on here. It's Your Health. We'll be right back, and make sure you call our sponsors and say, hey, I heard it on It's Your Health, and better yet, use their services. We'll be right back.
As it says here, low energy, depressed. You can try B12, but we've had a lot of luck with canine. So you can tell that we're going to be talking about dogs.
As usual.
I love dogs.
You want to bring us in, sweetheart?
Into what?
Into the show.
Oh, this is the show, and I'm bringing it in. So here we go. Dogs can differentiate between people with Parkinson disease by using a control. They can tell the difference between the control and somebody who has Parkinson's. They have achieved high sensitivity and specificity and showed there is an olfactory signature distinct to patients with the disease.
That's pretty impressive. Although a month ago, our dog kept licking my hand here, and here I had a lesion that had to be excised. So they have a sixth sense, if you will.
Well, I can top that. My sister came to visit a couple of years ago, who's a dog lover, and Donnie would not go near her. All he did was growl at her and keep his distance. And very shortly after that, when she went home and went for her mammogram, she had to go and have surgery.
Wow.
Because she had breast cancer, which she had no idea of. But I swear that dog could sense something just like they could on this.
We should send her a bill.
You ready for the next headline?
Yes, please.
Healthy plant-based diet may lower inflammatory bowel disease, the IBD. A healthy plant-based diet may reduce the risk for inflammatory bowel disease due to the anti-inflammatory properties of the diet. Plant-based diet may protect against IBD because it has anti-inflammatory properties that play a key role in keeping you healthy.
Well, we're back to getting rid of the processed foods, of which probably 70% or more of our diet consists of today. So getting into the more Mediterranean diets, less processed foods, less inflammatory. We'll cut down on inflammatory conditions.
He comes up with very unique things to cook. He's the cook, by the way. I'm not allowed in the kitchen.
You don't know where the kitchen is.
He won't let me in the kitchen. So, but he makes very good stuff. Okay, this is more of a sad one. Loneliness is a predictor of depression and poor health outcomes. It's a pressing public health issue with wide-reaching effects on mental and physical health. Loneliness.
Yeah, well, it's going around. Society has become less people person. You know, I say I used to be a people person until I started dealing with people. And a lot of anger out there. And so it's not the world we grew up in, which was a charmed environment. So
yes, it was. We were poor, but we were happy, and we had fun.
Exactly.
And we played red light, green light outside until it got dark.
And Raylan's.
Yes. Okay. Low Do you have a chance for a fracture of your bone? 31% of women who experience a bone fracture will experience a subsequent fracture within 5 years. And I am one of those people who suffered a wrist fracture. And it says here, they're a prime warning sign of underlying bone weakness and a significant indicator of future fracture risks. No matter what your DEXA scan says, if you've had a fracture, take it as a sign that you need to take substantial, comprehensive steps to support your bone health. Even a simple fracture of the wrist after stumbling tells its own story.
Well, fractures do predict fractures, and so it should be something which is a red light, as we say in our business, to look a little further so that you don't end up with a hip fracture, because that's life-changing.
And who told me I didn't have a fracture?
I don't know.
You.
I
said,
never met a man with so many faults.
That's not, you don't have a fracture, it's just sore.
Oh, well, we rubbed some dirt on it. It got better.
No, it didn't.
Yeah, I thought it did.
It was Donnie's fault. I have a whole bunch of questions for you now, and you have to answer them, true or false, and why.
Okay,
Okay, here's the first one.
giddy up.
I learned this one from my mom, so I'm telling you already it's true.
All right.
It takes years to digest gum.
That's false.
What?
Gum will be dissolved and come out the way everything else comes out.
My mother lied to me?
I think it was true in her day. The gum today will come out all right.
Okay, next one. Heavy lifting will cause a hernia.
Well, anything that increases intra-abdominal pressure will potentially create a hernia. So the answer is yes.
And you can also get it from long-lasting constipation or a cough, believe it or not.
Yeah, that's true.
True or false? Only alcoholics get cirrhosis.
Unfortunately, not the case. Other illnesses, particularly viruses, can lead on to cirrhosis.
And hepatitis B and C would do it also.
Correct.
Okay, nuts lead to diverticulitis. And I can tell you that the doctor I had years ago wouldn't let me have nuts because he said that I would get diverticulitis.
It's old school, but today diet plays less of a role in terms of diverticulitis. Sorry. I mean, people were saying you can't eat tomatoes because of the seeds. Well, they don't see tomato seeds when they do a colonoscopy, so.
This is a good one. True or false? Beans cause the most gas.
The most? Probably not. It would probably be along the dairy family if I had to bet.
That's absolutely true. And we're running out of time here, so tell me, so I'm going to skip that one. Smoking relieves heartburn.
The opposite happens.
Oh, that's true, but that was too fast. I didn't even get through that one. Aging causes constipation.
We see it in elderly, but it's mainly due to hydration, medications, things along those lines.
Not just because you're old.
Correct.
Fiber doesn't help with diarrhea.
I don't know. It could. I think you need to find out why you have the diarrhea rather than anything else, sweetheart.
It helps keep the stool from getting too hard or too soft. That's what the fiber does.
Right. So, moving right along, before we take our break, there was an issue about people using these, what are they,
Sharpies.
for their lips, for example, and highlighting their lips with Sharpies. And it's a bad idea, and we'll show you why. Because years ago, 5 years ago perhaps, one of my dogs, Donnie, who liked my coat took out a Sharpie and decided to eat it. And there's
He
the
was
result.
just a puppy then.
There's the result 5 or 6 years later. So
He's going to be 9, so it's even more years than that.
I sit corrected. Thank you, sweetheart.
You're welcome,
So
sweetheart.
no Sharpies for your lips
Or your dog.
or your dogs. We'll be right back after this brief commercial message. You're watching It's Your Health.
See, that's me. I loved Sally Star when I was 5. And my parents went, I don't know how they could afford it. In Elysburg, she was starring there in Elysburg at the golf course. And they took me there to see Sally Star when I was 5. And I was so disappointed because I expected to see her on a horse. And she was on the back of a convertible driving around.
WFIL, Channel 6. And I have my own Sally Star story. When I was probably pre-kindergarten and she was coming on, I would go behind the television set to get dressed because I was in my underwear and I thought she could see me. It's a true story. That's why I still go behind the... That's another story.
That's another story.
All
Let's
right.
not talk about that one. Okay, let's talk about wildfires. We know that there have been quite a few up in
Canada?
Canada. Yeah, I know where that is. Wildfire smoke exposure increases the risk for heart failure. Over time, it will do that. Even small, long-term exposures can raise the risk of heart failure, especially those who are most vulnerable. The problem was strongest with women. So don't go outside.
Yeah, it's unfortunate that the pristine atmosphere we grew up in is no longer as pristine. So yeah, you got to avoid that stuff.
Rebound weight gain, common after discontinuing anti-obesity medication. Significant weight gain after drug discontinuation was seen in many studies. According to the weight regain, your body weight continued to decrease within 4 weeks after treatment. But then it starts to show a gradual increase after 8 weeks. So you start to gain weight back.
Yeah, that's one of the problems with the GLP-1s. You get great weight loss, but when you stop it, you get a rebound and gain the weight plus. You would think your brain would remember, listen, walk past that Stromboli, but I guess it doesn't.
I like Stromboli. Okay, next headline. Low-calorie diets linked to depression. Calorie-restricted dieting is linked to an increased risk of depression.
Well, yeah, food is love, let's face it. And when you're losing weight and cutting down on calories, you're also probably starving your brain from high glucose levels that it loved. And the brain does not like you to go on a diet and will tell you so. So you might get depressed and end up falling back into a calorie diet that's not good for you.
People following a calorie-restricted diet may be at an increased risk of depression compared with non-dieters. How about that? Depression is everywhere.
Yeah, it is. What, sweetheart? That's not a good look.
Tips for building a stronger relationship. Open communication, curiosity, individual interests, and teamwork are just a few ways to develop a healthy relationship.
I didn't know that ours was sick.
Well, according to this, we have to have open communication.
You yell at me anytime you want. Yes,
Okay.
that's true. That is open.
We have to trust each other.
Next one.
You don't keep secrets from me.
Next one.
You're not answering these, you know. You're supposed to. We're supposed to have individuality, which we do because you're never home. We have curiosity.
Yeah, we're still curious.
Yeah, right. We enjoy time apart.
That's probably the best solution you've had here. Yes, less is more. So yeah, time apart is good.
It's essential.
Oh, yes.
Playfulness and lightheartedness. Joke and laugh together.
It's our middle name.
Whose middle name? Okay. All right, you'll like this one. Physical intimacy.
Oh, now we're getting somewhere. Go ahead.
Initiate and talk about sex.
Okay, well,
Handle rejection.
no, that's not good.
Discuss your desires.
I know, but you call me names when that happens.
Well, your desires aren't what I would normally, never mind. And we have to have conflict resolution. Disagreements and feeling frustrated or angry from time to time. Talk about your differences politely, honestly, and with respect.
This is too much work, sweetheart, I'm telling you.
Well, those are all the things that we're supposed to do with each other,
Oh, okay. Well,
for each other.
we'll put that in the bathroom reading part. So we can take it under consideration.
For some reason, I think you're not taking any of that seriously.
I'm very serious about that, yes.
So you don't keep any secrets from me.
No, I don't.
I didn't even know you had a problem with your hand.
Oh, well, that was a secret. So, the dog told me.
All right. What causes extreme mood shifts in women?
Trying to follow what you just said, I think, would...
I've experienced this for sure. If you've ever felt angry or frustrated within moments of feeling happy or elated, you have experienced a mood shift. That definitely has happened. And they talk about, it happening premenstrual, when you're pregnant, when you go through menopause. I'm already past menopause. But I will tell you, when I went through menopause, the best thing he could have done was just lock me in the basement until I was past it. I don't think there's anything worse that a woman has. I mean, having a baby is painful, but going through menopause, nothing can save you from that. So I won't talk anymore about that.
That's why they call it a change in life, right?
Oh, it's awful.
And some people never get over it.
Oh, ha, 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 ha. Do you want to save this?
No, let's...
Well, go ahead. You take care of this. I don't want to have anything to do with that.
There's a patient who was out in the woods, and he had high boots on, high socks, protected from ticks, and within a few days developed this rash, which looks kind of ugly. It was painful and itchy. And it wasn't an infection, but it was caused by what are called chiggers. You remember that, chiggers?
I've heard of that.
Yeah, they're these little insects that can crawl into your...
Boots?
Yes, and socks, and obviously did in this case. Treated with some topical steroids. Wasn't serious, wasn't like a tick bite that's going to create Lyme disease or things along those lines. But when you see a rash like this, it means you came in contact with something that you didn't like.
And that's gross.
Oh, well. Thank you. And we'll be right back after this brief commercial message right there.
No, I can't believe you said thank you after everything that we just discussed.
Well,
Sure, thank you.
okay, we'll be right back.
Welcome back. This is the last segment, which makes my husband very happy that we're past the other segment.
Oh, absolutely.
And we have an inspiration. You can't go back and change the beginning, but you can start where you are and change the ending. Very well said.
Yep.
Okay, we'll go right to headlines. Cannabis use may double the risk of death from cardiovascular disease. It may increase health issues including stroke, acute coronary syndrome, and death from cardiovascular disease associated with frequent cannabis use. Cannabis should be treated like tobacco, maybe not criminalized, but discouraged, with protection of bystanders so they don't get the secondhand smoke. So what do you have to say about marijuana?
Yeah, I never went there, to be honest with you. I can't say I've ever tried it, even in college. But nevertheless, keep in mind the adolescent brain does not mature till 25. And there's no doubt that the use of these drugs in your teenage years or before you're 25 will cause actual brain damage, lower your IQ, and God knows affect you later on in life. So I know everybody wants to lower the standards, if you will, or the risk factors, or think it's cool, but it's a drug, and our bodies are not designed to be taking in these things. Our bodies are designed to take in fresh air, fresh water, and quality food, not chemicals like this. So
I also worry that people who use this and then get in their car and drive, I don't think they're ready to do that.
well, if it's mind altering, yeah, it's not a good idea.
Okay, let's talk about COVID, your favorite subject. New COVID variant called Nimbus may cause painful razor blade throat symptom. It's on the rise, and it's reported as razor blade throat. If you have a severe sore throat, it's important to get tested to rule out strep throat to avoid severe complications.
Well, yeah, this COVID is the gift that just keeps on giving. And we saw 2 cases this past week in the middle of summer. Do you believe that?
No kidding.
And so, again, it was at a gathering, pool parties, funerals, weddings, things along those lines. The virus is very contagious, not as deadly. When COVID first came out,
It was deadly.
it was signing 2 death certificates a day, 2 a day. It was really, really horrible. But nevertheless, it's coming back, and we'll probably have some blip in the COVID patients as we get into fall and winter.
Not much with flu, I haven't heard.
No, you're not going to see the flu in the summer.
No, but I mean, before we got to the summer, it didn't seem like there was a lot.
Well, a lot of people got flu shots, and I think they learned from COVID about distancing, covering your mouth, staying at home when you're sick. So I think, in general, the COVID sort of lowered, in a sense, the epidemic of influenza because they were doing the right thing.
Do I have to do this one?
If it's medical news, yeah, just...
Okay. Ozempic Penis. Males are reporting a surprising new side effect. But they say Ozempic Penis is not a true side effect of those drugs. Then what is it?
Well, GLP-1s have created a lot of other illnesses, if you will. You've heard of Ozempic face and Ozempic teeth. And this one, I don't know how it found itself to medical headlines, but they feel as though men who look at themselves, or however they look at themselves, appear larger.
Well, they also realize that the Ozempic might improve blood circulation and erectile function.
Chances are it just has to do with less fat in that area. And you probably, when you minus the fat, you can see the more of whatever the fat was hiding.
Oh, now we're going to talk about testosterone. GLP-1 drugs may boost testosterone levels in men with obesity or diabetes. They're associated with improved testosterone in males with obesity or type 2 diabetes. Weight loss can support healthy testosterone levels, but we know that testosterone levels have reduced over the years.
Well, true, there is a male menopause, and testosterone levels can be affected by other health issues, such as diabetes and obesity. I think the interesting thing is when we see individuals who have low testosterone levels and and have fatigue or other symptoms that require treatment with testosterone, they would think that they're now going to be Superman behind closed doors. That is often not the case. You cannot necessarily give testosterone supplements and expect a better personal life. Not all the time.
Okay. I'm giving this one to you about bright light therapy. It's effective for non-seasonal depressive disorders.
Right. There's the thing called SAD syndrome, seasonal affective disorder, which we're going to be heading into sooner rather than later. It gets darker earlier, darker longer, a little colder, melancholy in the air, things along
I
those.
would rather winter any day. Oops.
Okay. In either event, they've done studies where they actually put patients in brighter lights and brighter environments, leave the lights on, and here they have found that it is effective in treating that seasonal affective disorder. The people truly aren't depressed, but the environment that is created by the northern hemisphere, if you will, can impart a depressive, melancholy state.
Before we end, I'm just going to remind you that you're going to tell me any secrets that you have.
Is that right? You'll have to squeeze it out of me.
I'll work on it.
All right. And on that note, thank you for joining us for It's Your Health. We like to inform you and, of course, entertain you.
And thank you, Sammy.
Yes, he's
our one and only.
he is a Friday like every day. You know, they say like a girl Friday. Well, he's the man Friday. He just gets things done. All right, be safe out there, stay cool, and enjoy. And
If you see me, miss, stop and say hello.
let's get ready for some football. What do you say?
Yeah, the end 30 days.
You're right. I forgot who won the Penn State Notre Dame game. What was that in the bowl games? Maybe you could call in and tell us who won that game. Thank you.
Right, we forgot.
All right, enjoy.